Because it really was. This was led operationally by the University of Maryland Medical System, who took it seriously from day one in terms of an incident command center, and we had our sort of our marching orders. They were very, very well organized from the beginning of this COVID event, and when it became very clear the timing of this vaccine, we started early, and because we started early, that's the reason we got vaccine in arm today. So I couldn't be more thrilled. This is a culmination of really several months worth of work, but condensed down into about a month, when it was imminent that this vaccine was going to probably come out before Christmas. And it was a lot of system meetings for the University of Maryland. It was a lot of local meetings, because obviously we don't coordinate our response exactly the same way the medical center coordinates theirs. So it has been a big ask for a lot of people, and I just am amazed about how many people stepped up. And forgive me on my timelines, Dave, I'm a little sleep deprived, but it has been several weeks since we've known this required ultra cold storage. And again, the University of Maryland Medical System realized the need that we need to get at least one freezer in the system to be able to handle these doses. Well, not only did we get one, we were able to get four, and one was placed on the shore for storage. So I was happy with that decision. That meant that we have our vaccine secured here. And I'm the one who has to take care of it, which I'd rather do than leave it up to somebody else. So it was a long time planning, and we just, as you've probably seen, we just got the vaccine delivered last week just in time. Now, we knew that timeline. The timeline was between the 8th and the 12th. So it came in pretty much right on time, which to me, in the setting of knowing that there's an ultra cold storage vaccine coming out, to be able to mobilize and get a freezer that can accommodate that within 3 weeks, that's logistically amazing to me. The freezer we got holds 155,000 doses. So we have a lot of vaccine storage. As far as the other ramping up of things that we need, we've got a couple warehouses full of things up in Baltimore that sort of stockpiled in the COVID era. And we're not going back to a time where we even felt like there would have been a question about it. So we've been well stocked with pretty much everything that we need. It arrived to University of Maryland on Monday, and they packaged it up, got it out to all the system hospitals within a 36-hour period of time.
I hear the waiting room is being used as the place where people are getting their shots.
It is at Easton. It's the memorial lobby, the hospital lobby. At Dorchester, it's the same, but we have it extending a little bit into some other areas just for workflow issues. And then at Chestertown, it's in a large conference room. So we've got enough people to staff all three sites and to get people through these lanes quite easily. So we have chosen to do the option where we get it out to people as quickly as we can.
Does that come out to kind of an average per day that you're aiming for?
Well, we have 2,400 employees, give or take. So, and then obviously we have 2 doses to give, one dose and then the other one either 3 weeks apart or 4 weeks apart, depending on which vaccine they're going to get. Right now, the Pfizer vaccine is 3 weeks. So we have the capacity to, if we had the 2,400 doses of vaccine, we would be able to get it out to every single team member within a month, that first dose, and then the follow-ups within 3 weeks to a month after that. Right. I would be very surprised if the Pfizer vaccine turned up at a pharmacy, a local pharmacy. It's so logistically difficult to store. To give you an idea, when you receive the vaccine from Pfizer, it's in a storage unit that is minus 70 or 80 degrees Celsius, obviously ultra cold. And so you transfer that to your ultra cold freezer, and then it's good for months. When you open that, what they call that box of, and right now they only come in 975 dose boxes. So once you open that, you have 5 days to give that vaccine. And so it's a huge ask for a pharmacy to be able to. I don't see how they'd be able to do it. So the pharmacies will play a role for sure. They'll be playing a role in vaccinating our community members. But I see the Moderna vaccine and possibly the future vaccines after that being more of a role in the community setting for sure. I think that this initial allotment was a test phase. I think they wanted to see whether or not the systems were capable of storing it, and if they transported it to other locations, whether they were successful in doing that. You know, the last thing the state and the CDC want to do is give 2 of those boxes of, you know, almost 2,000 doses to a system that wastes it. So I firmly believe that this was a test run, and that we're gonna see increasing supplies of vaccine in the coming days to weeks. I don't anticipate that if you were to talk to me in mid-January, I think that we will be talking about finishing up our employees and moving on to the community.
Can you get sick from taking the vaccine?
You cannot get COVID from taking a COVID vaccine. So I think that's one of the bigger misconceptions out there, is that it contains absolutely no particles of COVID, no trace of COVID whatsoever. So I think that's once we get that message out, that's going to take care of some people who have that fear for sure.
What happens if you're pregnant or you're breastfeeding?
Yeah, there's guidance from the CDC. The CDC says that it is not a contraindication, meaning that pregnant women should get the vaccine. But that's something that it really needs to be discussed with the pregnant woman, or the woman who is trying to get pregnant, to have with their personal physician and have that conversation together. I think we're going to get a little bit further guidance, maybe a little bit more clarification on that. But right now, it's the suggestion is to make sure that they talk to their doctor about it.
How about if you already have a pre-existing immune compromised system? Is this recommended?
It is. Yeah, it is. There are very, very few what are called contraindications to this vaccine. So the efficacy in people that you describe has not been studied to a large extent. They weren't included in the studies to a large extent, but it is recommended that those people do get this vaccine.
And what happens if you've already been tested and presumably recovering from COVID? Is this still recommended for those folks?
It is. Yep, it is still recommended. It seems a little counterintuitive, because you'd think you'd have those antibodies running around in you, but the recommendation is to get vaccinated even if you've had COVID in the past.
You know, what happens when you take the shot? You're able to take off your mask? How does that work?
No, unfortunately, we're not able to take off our masks. That's going to be a little bit. I know people are looking forward to that day, but we're several months away from that, I believe. You are protected relatively soon after the first injection, but you're not fully protected until after the second injection. That said, let's say you're 2 months down the road after your COVID vaccine, it is thought you still have the ability to transmit the disease. Now, that's still being hashed out, but that's what we're going by right now. And it is still extremely important for people to wear their PPE, because it does still get transmitted potentially even if you have the vaccine. You won't be sick from it, but you can still actually transmit it if you've been exposed to it.
Are there any other myths we could bust today? I mean, is there other things that you want to make darn sure the community knows about as we begin this really incredible moment in our history?
I think, Dave, one of the things, the 2 main things that people are concerned about are getting COVID from the vaccine, which we've already addressed. The other thing is I hear a lot that this process was just way too fast, and they just don't. That's not a normal process, and they're right. That is not a normal process. But I think that what people have to appreciate is the urgency that the federal government put on this task. They took the red tape and unrolled it in every part of this process. So, you know, the reason why a vaccine takes 8 to 10 years to get to market is because generally the studies they try to be a little longer, but it's also because between each phase and even sub-phase of any clinical trial, a drug company has to go back and say, is this financially feasible to continue? And what the government did was said, I don't want you to worry about that. We're going to pay you for your doses. You just make the vaccine. You come up with the plan, make the vaccine, and we'll make sure you get paid. So I think that's the other, and it's not a misconception. It is a true statement. This is a way faster than any other thing that we've seen ever. But I think, in my opinion, I think this is going to go down as one of the most amazing feats in health history. I mean, this is a public health miracle.